Have you ever had that deep down feeling that your body is trying to tell you something important? Little discomforts you brush off, a tiredness that just won't quit. We live such busy lives that our body's whispers often get lost in the noise. But what if those seemingly harmless signals were actually a hidden map to something signal that needs your attention right now? What if one of those questions you ignore about your body was a crucial warning that can't wait? Many signs of serious conditions like cancer are deceptively subtle at first. The truth is, our bodies talk, and ignoring those calls can come at a cost no one wants to pay. In this video, we're going to uncover 12 of these silent warning signs that often go unnoticed. My goal is not to scare you, but to empower you with knowledge so you can become the lead detective of your own health. Stay with me, because what you're about to discover here could quite literally save a life, maybe even yours. I know that talking about cancer can give you a knot in your stomach, a certain apprehension, and it's completely natural to feel that way. But I promise we'll navigate this topic with great care, responsibility, and above all, with a focus on what truly matters, your health and well-being. The knowledge we're going to share isn't meant to paralyze you with fear, but to set you free through information. Think about it. Why is it so important to pay attention to our body's signals? The answer is simple and powerful: early detection. Imagine John's case. He started noticing something different, a subtle change in his daily life that persisted. Instead of ignoring it, he decided to investigate. He sought medical help. And today, John tells a story of overcoming, a story where his attention to those first signs was the first and decisive step towards successful treatment. That's the power of being aware. Statistics show that when cancer is discovered early, the chances of effective treatment and cure increase dramatically. It's like having a map that shows you the safest route even before the storm hits. But of course, it's crucial to clear up one thing. Not every sign means cancer. Our bodies are complex and react to many things: stress, diet, changes in routine. Many of the signs we'll discuss can be caused by completely different and, most of the time, less serious conditions. The important thing, the really crucial thing, is to know when it's time to raise a flag and see a doctor. They, and only they, can thoroughly investigate and give an accurate diagnosis. Have you ever had a symptom, rushed to search the internet, and left feeling like you had every disease in the world, more confused or scared than before? Well, online information can be useful, but it can also be a huge trap for our anxiety. Nothing replaces an evaluation by a healthcare professional. So what can you expect from this video? We're going to dive headfirst into 12 cancer warning signs that are frequently ignored, one by one. I'll explain in simple terms, without complicated technical jargon, what to look out for in each one, and just as importantly, why they often go unnoticed in the hustle and bustle of life. And at the end, we'll have a very practical conversation about how to approach your doctor if you identify something that worries you. Our first sign is something that I'm sure many of us have felt at some point, maybe even daily. But it takes on a completely different meaning when it becomes persistent and seems to have no obvious explanation. Shall we find out together what this first warning is? Sign number 1, persistent and unexplained fatigue. Now, who hasn't felt tired, right? After a long day at work, a hectic week, or even after intense physical exertion, tiredness is a natural response from our body. It asks for rest, for recovery. But the fatigue we're talking about here is different. It's a deep exhaustion, a weariness that doesn't significantly improve even with a good night's sleep or a restful weekend. It's that feeling of constantly being out of energy, without an apparent cause like a bad flu or one sleepless night after another. Have you ever felt like that for weeks on end, where getting out of bed feels like a monumental task and activities that used to be enjoyable become a heavy burden? This persistent fatigue is often ignored because it's very easy to attribute it to other things. "Oh, it's just work stress. I haven't been sleeping well lately. It must be age catching up." These are common excuses we tell ourselves, and in many cases, they might even be true. However, when this fatigue drags on for weeks or even months and significantly interferes with your quality of life, without a clear reason, it deserves closer investigation. Some types of cancer, like leukemia, colon cancer, or stomach cancer, can cause this extreme fatigue. This can happen due to blood loss, the cancer itself consuming the body's energy, or substances released by the tumor that affect metabolism. So, what should you watch for? Pay attention if this tiredness is new, if it has worsened considerably, if it's not linked to specific exertion, and, most importantly, if it doesn't improve with usual rest. Remember, persistence is the key word here, but extreme tiredness isn't the only signal our body uses to communicate imbalances that could be important. There are visible changes that happen in our body weight, which also deserve our attention and care. Sign number 2, unexplained weight loss. Many people struggle to lose a few pounds, so when weight starts Korolevsky to drop esfuerzo, without effort, without dieting, without an increase in physical activity, the first reaction might even be joy. Who wouldn't like to shed a few pounds out of nowhere? But be careful. Significant weight loss, generally defined as more than 5% of your body weight over a period of 6 months to a year, that happens for no obvious reason, needs to be investigated. Do you know anyone who's been through this, who saw the numbers on the scale drop without understanding why, and maybe even wondered if something else was going on? It's easy to ignore this sign, especially if the person was already trying to lose weight. They might think, "Finally, my diet is working," even if they're not doing anything differently, or they might attribute it to increased stress, a busier phase of life. However, unexplained weight loss is a common symptom of several types of cancer, such as pancreatic, stomach, esophageal, or lung cancer. This happens because cancer cells consume a lot of energy, which can lead to burning more calories. Additionally, cancer can release substances that alter how the body processes food, leading to muscle and fat loss. So, what to look out for? If you or someone you know is losing weight without trying, and this loss is noticeable, say more than 10 pounds in a few months for an average weight person, and there's no clear explanation, like a drastic change in diet or a new intense exercise program, it's time to talk to a doctor. We're not talking about any small weight fluctuation which is normal, but a consistent reduction without an apparent reason. It's interesting how our metabolism and weight can give us important clues about our internal health, isn't it? Now, let's shift focus, Xiaoxi, and talk about something that directly affects our largest organ, our skin, an organ that's exposed and, for that very reason, sometimes has its signals normalized or underestimated. Sign number 3, skin changes. Our skin is like an open book that tells a lot about our health. It reacts to the sun, to time, to allergies, moles, spots, warts. We all have some. But it's crucial to be aware of any new changes or alterations in existing ones. We're talking about a mole that has changed color, size, or shape, a sore that doesn't heal, a spot that itches or bleeds easily, or the appearance of a new skin growth that looks strange. Why are these signs often ignored? We often think, "Oh, it's just a sunspot. This little sore will heal soon." New moles appear with age. And indeed, many skin changes are benign. However, the skin is the organ most commonly affected by cancer, and skin cancer, including melanoma, which is the most dangerous type, often manifests through these changes. What to watch for? There's an easy rule to remember, the ABCDEs of melanoma, which can help. A for asymmetry. One half of the mole is different from the other. B for irregular borders. Edges are ragged, poorly defined. C for color. Multiple colors or a very dark or irregular color. D for diameter, usually larger than 6 millimeters, the size of a pencil eraser, though melanomas can be smaller, and E for evolving, any change in an existing mole in size, shape, color, or the appearance of new symptoms like itching or bleeding. Additionally, any new skin lesion that doesn't disappear within a few weeks, or a sore that doesn't heal, deserves a medical evaluation. The skin speaks, and sometimes it screams for attention through these small alterations. The skin truly tells us many stories, but our digestive system also has a vast repertoire of signals that, when not interpreted correctly, can lead to problems. The next sign we'll explore is a clear example of how our body's internal workings can manifest in ways that demand our careful analysis. Sign number 4. Persistent changes in bowel or bladder habits. Our digestive and urinary systems are essential parts of the body's functioning, and any significant, persistent change in their habits can be a warning sign. When we talk about bowel habits, we're referring to things like diarrhea or constipation that last for more than a few days, a feeling that the bowel hasn't emptied completely after a movement, or the presence of blood in the stool, which can be bright red or darker, almost black. Regarding urinary habits, warnings include pain during urination, blood in the urine, or a need to urinate more or less frequently than usual, especially if this happens suddenly and continues. Why are these signs often ignored? Well, occasional digestive problems are extremely common. Who hasn't had a stomachache from something they ate, or a period of being more constipated or having looser stools due to stress or travel? Similarly, small changes in urinary frequency can be attributed to the amount of fluids we drink. Because they're common, it's easy to think, this will pass. It must have been something I ate. However, when these changes become the new rule, when they persist for weeks, they shouldn't be normalized. Cancers such as colorectal, bladder, or prostate cancer can cause these symptoms. For example, colorectal cancer can cause blood in the stool or a change in bowel patterns. Bladder cancer can lead to blood in the urine or pain during urination, and prostate cancer can make urination difficult or increase frequency. What to watch for? Any unexplained and lasting change in your bowel or urinary habits. Blood in the stool or urine is always a warning sign that requires immediate medical consultation. Persistence, once again, is a crucial factor here. We've seen 4 important signs so far. Do you notice how some of them are quite common in our daily lives, which further reinforces the need to be attentive not just to the sign itself, but to its persistence and the changes it represents in our normal pattern? The knowledge we're building together here is a powerful tool. The next signs we'll explore involve other parts of our body, and some of them can be even more surprising in how they manifest. Stay with me so you don't miss any crucial information. Sign number 5, persistent pain. Pain is one of our body's most basic warning mechanisms. It tells us something is wrong. It could be acute pain from an injury, a tension headache, muscle aches after exercise. Most pain has an identifiable cause and disappears with time or treatment. But what about when pain appears, perhaps subtly at first, and simply doesn't go away? Pain that persists for weeks, or even months, and has no clear explanation, or doesn't improve with common pain relievers. Has it ever happened to you, having pain like that, constant, that left you truly puzzled or worried about its origin? This persistent pain is often ignored because we can get used to it or try to find simple explanations. It's my posture, I must have slept wrong, it's just a little chronic pain I've always had. However, pain can be an early symptom of some types of cancer, such as bone cancer or ovarian cancer. Persistent headaches that don't improve with medication can, in rare cases, be a sign of a brain tumor. Persistent back pain can, also in less common situations, be linked to cancers like colorectal or prostate. What's important to understand is that cancer-related pain can occur due to the tumor pressing on organs, nerves, or bones, or due to chemicals released by the tumor. So, what to watch for? Any new pain that is constant, worsens over time, has no obvious cause, or doesn't improve with usual treatments. If the pain wakes you up at night or interferes with your daily activities, it's an even stronger reason to see a doctor. Don't normalize pain that your body is clearly signaling isn't normal. Pain is without a doubt a clear warning when persistent. But what about when the sign is quieter, more subtle, like a difficulty that suddenly arises when performing an action as basic and automatic as swallowing food? Sign number 6, persistent difficulty swallowing, dysphagia. Swallowing is something we do countless times a day without even thinking about it. But for some people, this action can become difficult, uncomfortable, or even painful. We're talking about a sensation of food getting stuck in the throat or chest, or frequent coughing and choking when trying to swallow. This is known as dysphagia. Why is this sign often overlooked? Mild or occasional difficulty swallowing can be attributed to eating too fast, not chewing properly, or a slightly irritated throat. But when this difficulty is persistent, when it happens frequently and worsens over time, it should not be ignored. Difficulty swallowing can be a sign of esophageal, throat, or stomach cancer. The tumor might be narrowing the food passage or affecting the nerves and muscles involved in swallowing. What to watch for? If you feel like food gets stuck, if you need liquids to help push food down, if you have pain when swallowing, or if you've started avoiding certain foods because they're hard to swallow. Unexplained weight loss accompanied by difficulty swallowing is also a major warning sign. If this difficulty persists for more than a few weeks, a medical evaluation is essential. Our digestive system, as we've seen, is quite complex and can give us various signals. Moving on from difficulty swallowing, which affects the beginning of this system, let's now look at something that can happen directly in our mouth and, due to its location, often ends up being neglected or confused with common dental problems. Sign number 7, mouth or tongue sores that don't heal or white patches. The mouth is an area that frequently experiences minor injuries. Who hasn't bitten their cheek or tongue, or had an annoying canker sore that took a few days to disappear? These small wounds usually heal quickly. However, what deserves our attention are sores, canker sores, or ulcers in the mouth, on the lips, or on the tongue that simply don't heal after 2 or 3 weeks. Another important sign is the appearance of persistent white or red patches on the lining of the mouth, tongue, or gums. These patches are called leukoplakia, white, or erythroplakia, red, and can be precancerous. Why are these signs ignored? Often because people get used to minor irritations in their mouth. They might think it's just a stubborn canker sore, or that the patch is a result of some friction with their teeth or dentures. However, sores that don't heal or persistent patches can be signs of oral cancer. Mouth cancer can develop in any part of the oral cavity, including the lips, tongue, gums, lining of the cheeks, and roof of the mouth. What to watch for? Any sore in your mouth that doesn't improve in 2 to 3 weeks. Any unusual white or red patch that appears and doesn't go away. Persistent mouth pain, difficulty chewing or swallowing associated with these lesions, or a lump in the cheek are also warning signs. Regular visits to the dentist are important as they are often the first to detect these changes. Don't underestimate a persistent little sore in your mouth. From sores that stubbornly refuse to heal in the mouth to unexpected bleeding that occurs in other parts of the body. The next sign we'll discuss involves exactly that, and its manifestation can vary quite a bit, requiring an even more attentive eye on our part so we don't normalize it. Sign number 8, unusual bleeding or discharge. Any unexpected bleeding or abnormal discharge from any part of the body should be investigated. This includes coughing up blood, blood in vomit, blood in the stool, which we've already mentioned, but it's worth re-emphasizing here due to its importance. Blood in the urine, abnormal vaginal bleeding, between periods, after menopause or after intercourse, or an unusual and persistent vaginal discharge. It also applies to a nipple that starts to have a bloody or other colored discharge. Why are these signs ignored? Occasional minor bleeding can be attributed to less serious causes. For example, bleeding when brushing teeth might be gingivitis. A nosebleed could be from dry air. Women can have variations in their menstrual cycle. However, when bleeding is unexplained, persistent, or the discharge is new and different from usual, it's crucial not to ignore it. Abnormal bleeding can be a symptom of various types of cancer. Coughing up blood can indicate lung cancer. Blood and vomit can be from stomach or esophageal cancer. Rectal bleeding can be colorectal cancer. Abnormal vaginal bleeding can be a sign of cervical, endometrial, or ovarian cancer. Nipple discharge can, in some cases, be linked to breast cancer. What to watch for? Any bleeding that is outside your normal pattern and has no obvious explanation. Secretions or discharges that change in color, odor, consistency, or amount, and that persist. Don't be ashamed to discuss these symptoms with your doctor. They are valuable information. We're making good progress on our knowledge journey and have already explored 8 important signs. It's a lot of information, I know, but every detail here is designed to help you connect better with your body and your health. The knowledge we're building together is, without a doubt, a powerful tool. If you're finding this information useful, if it's helping you understand better how to take care of yourself, take a quick moment now and subscribe to the channel. It's a simple way for you not to miss future content on health and wellness, and it also greatly helps our work reach and assist even more people who need this information. Deal? Then let's move forward, because the last 4 signs on our list are equally crucial, and one of them is particularly sneaky, as it's often confused with a totally different and very common problem. You'll want to know what it is so you don't fall into that trap. Reaching the final stretch of our list of 12 signs, the 9th warning we'll discuss is something that can often be discovered by chance, during a self-exam, or even while getting dressed: the appearance of a lump or swelling in some part of the body. Sign number 9, persistent lump or swelling. Many people immediately associate the word lump or swelling with cancer, especially breast cancer. And indeed, a new lump or thickening in the breast or armpit is an important sign that should be evaluated. But lumps or swellings can appear in many other parts of the body, such as the neck, testicles, abdomen, or any area of the skin. And they also deserve attention if they are new and persistent. We often discover these lumps in gradient by chance, during a shower, while applying lotion, or simply by touching the skin. Do you have the habit of self-examining, of observing your body attentively to notice these small changes that might appear? Why might a lump be ignored? Some lumps are painless at first, or they can be mistaken for a benign cyst, a swollen lymph node due to a passing infection, or even an insect bite that took a while to disappear. However, a lump that doesn't go away after a few weeks, that grows in size, or that is fixed and hard, needs to be examined by a doctor. Lumps can be the first sign of various types of cancer, including breast cancer, testicular cancer, lymphomas, cancer of the lymphatic system, or sarcomas, cancers that arise in connective tissues. Regular self-examination of the breasts for women and of the testicles for men is an important practice. And generally, being aware of any new little lump or persistent swelling anywhere on the body is crucial. Don't wait to see if it disappears on its own if it causes you any doubt. Lumps are a fairly clear physical warning when we notice them, but what about the signs that affect our breathing, our voice, in a more subtle way that can easily be confused with common respiratory problems, especially during weather changes or flu seasons? Sign number 10, persistent cough or hoarseness. A cough is a common reflex of our body to clear the airways. It can be caused by a cold, flu, allergy, or irritants like smoke. Similarly, Hoarseness can arise after talking a lot, shouting, or during laryngitis. Usually these symptoms improve in a week or two. But what happens when a dry or phlegmy cough or a hoarseness in the voice simply doesn't go away, even after 3 or 4 weeks? It feels like that cold that never cures, or that throat irritation that has become your daily companion, doesn't it? These symptoms are frequently ignored because they are so closely associated with common respiratory problems, and most of the time they really are. People might try syrups, lozenges, teas, thinking it will eventually pass. However, a persistent cough can be a symptom of lung cancer, especially in smokers or former smokers, but not exclusively. Persistent hoarseness can be a sign of laryngeal cancer, vocal cords, or thyroid cancer. If the cough is accompanied by blood, chest pain, or shortness of breath, the urgency to see a doctor is even greater. What to watch for? A cough that lasts more than 3 weeks, especially if you are a smoker or have a history of lung problems. Hoarseness that doesn't improve after 2 or 3 weeks, especially if there's no obvious cause like a bad cold. Don't treat a chronic cough or hoarseness as something normal. The voice and breath really do give us important clues about what's happening internally. The next sign we'll discuss brings our focus back to visible changes, but this time, not lumps, but something many of us have scattered across our bodies: moles or warts. Sign number 11, changes in moles or warts. And we've already briefly touched on skin changes in sign number 3, but this point deserves a specific spotlight on moles and warts, as they are very common and changes in them can be an important indicator, especially for melanoma, the most aggressive type of skin cancer. Most moles and warts are harmless. However, any change in the size, shape, color, or texture of an existing mole or wart, or the appearance of a new one that looks different from the others, should be evaluated by a dermatologist. Why are these changes ignored? Because moles can change slowly over time, and we might not notice these gradual alterations. Or we might think a new mole is just another one, part of aging, or sun exposure. However, as I mentioned before, the ABCDE rule is a valuable tool here. Asymmetry, irregular borders, varied colors, diameter larger than 6 millimeters, and evolving change. Additionally, if a mole or wart starts to itch, hurt, bleed, or form a crust, these are additional warning signs. People with many moles, a family history of skin cancer, or who get a lot of sun exposure without protection should be extra careful. Regular self-examination of the skin and annual visits to the dermatologist for a full checkup are essential for early detection. Keep an eye on your moles; they might tell you more than you think. From visible skin alterations to more internal changes in our body's functioning, like the last sign on our list, which involves something that can affect both men and women, but often manifests in gender-specific ways, and which might be a bit more delicate to discuss but is crucial for our awareness. Sign number 12, changes in sexual organs or sexual function. This is a topic that might cause some discomfort, but it's vital that we pay attention. For women, this can include unexpected vaginal bleeding, especially after menopause, between periods, or after intercourse. Pain during intercourse that is new or persistent, or a vaginal discharge with a strong odor or unusual color that doesn't improve with simple treatments are also warning signs. Persistent swelling or pain in the pelvic or abdominal region also deserves attention. For men, signs can include pain or swelling in the testicles, a testicular lump, persistent problems getting or maintaining an erection, or blood in semen or urine. Why are these signs ignored? Often due to shame, embarrassment, or thinking they are normal problems related to age, the menstrual cycle, or common infections. However, these symptoms can be linked to gynecological cancers such as cervical, ovarian, endometrial in women, or testicular, prostate, or penile cancer in men. What to watch for? Any persistent and unexplained change in the function or appearance of your sexual organs. Pain, bleeding, or unusual discharge that doesn't go away. Don't hesitate to see a gynecologist or urologist. These specialists are accustomed to dealing with these issues and can offer the appropriate guidance and treatment. Your intimate health is an integral part of your overall health. And with that, folks, we close our list of the 12 cancer signs that are frequently ignored. Whew. It's quite a bit of information, I know, and maybe some of these points have left you thoughtful or even a little worried. But as I said at the beginning, and I want to reinforce now, knowing is just the beginning. The real power, the real transformation, lies in what we do with this knowledge. And that's exactly what we're going to talk about in our next and final block. How to turn all this awareness we've built together into effective and positive action for your health. So, what do you do now with all this information about the 12 signs? The first and most important golden rule is, don't panic, don't self-diagnose on the internet, and above all, don't ignore persistent signs. If you've identified one or more of these warnings in your body or in the body of someone you love, and they are persisting or causing you concern, the only correct path, the only safe path, is to talk to a doctor. Who here, upon feeling something different, hasn't rushed to Dr. Google and come away certes with their heart in their mouth, thinking they had every problem in the world and with more anxiety than answers? Exactly. The internet can be a source of information, but also of a lot of misinformation and unnecessary panic. A medical consultation, a face-to-face conversation with a healthcare professional, is irreplaceable. And to make that consultation as productive as possible, it's good to prepare a little. Remember John's story, the one I mentioned at the very beginning of the video? Part of his success in getting an early diagnosis was precisely arriving prepared for the conversation with his doctor. So, write down your symptoms, when they started, their frequency, their intensity, if anything makes them better or worse. If you have a relevant family health history, like cases of cancer in the family, bring that information too. Be completely honest and as detailed as possible with the professional. And most importantly, don't be ashamed to ask questions. Clear up all your doubts, no matter how simple they may seem. A good doctor-patient relationship is built on trust and open communication. Besides being attentive to signs, we can't forget the vital importance of regular preventive exams. Even if you're not feeling anything at all, checkups and routine screenings, those recommended for your age and gender, are crucial tools for detecting cancer and other diseases in their early stages, often even before any symptoms appear. Talk to your doctor about which exams are recommended for you. And here I want to leave a message of great hope. Medicine is advancing by leaps and bounds. Most types of cancer, when discovered early, have high, very high chances of successful treatment and cure. Your attention today, your proactivity in taking care of yourself, can be the determining factor for your health and quality of life tomorrow. Knowing these signs isn't meant to make you live in fear, but to empower you, to give you the tools to be an active agent in your own health. We've reached the end of our journey through the 12 frequently ignored cancer signs. I sincerely hope that this video has been a beacon of knowledge for you, a source of clear and useful information, and not a source of unnecessary anxiety. May it bring you more peace of mind from knowing what to look out for and, above all, the motivation to take care of yourself with even more affection, with even more attention. If this information was valuable to you, if it helped you in any way, imagine how important it could be for someone you love, a friend, a family member. That's why I ask you, share this video. A simple click, a simple forward, can light a warning and care lamp in someone else's life. It can encourage someone to seek help in time. And you, which of these 12 signs caught your attention or surprised you the most? Or maybe you know a story, without exposing anyone, of course, about how paying attention to a sign made all the difference in someone's health journey. Share your thoughts in the comments below. Let's continue this important conversation and exchange experiences. And of course, if you value content about health and well-being, made responsibly, with research, and with a lot of care, just like this one, join our community, subscribe to the channel here, and turn on the notification bell so you don't miss upcoming videos. We prepare each piece of content thinking about helping you live with more health, more information, and more awareness. If you want to seek out even more information about cancer prevention and support, I'll leave a link in the description to some trusted organizations that do incredible work in this area. Always remember, your body is your greatest ally, your temple. Listening to it attentively, taking care of it with love and respect, is one of the greatest acts of self-love you can practice. Prevention, knowledge, and conscious action are your greatest shields. Stay well, take care of yourself, and live fully. Thank you so much for your company so far, and until next time.